The federal government of Nigeria has reaffirmed its commitment to sanctioning persons who are engaged in administering wrong drugs to patients so as to curb malpractices and abuses in the country. Minister of Health Dr. Sanction Unprofessional disclosed this at the celebration of the 2022 World Patient Safety Day in Abuja. He said this will enhance best practices in drug administration as millions of lives are lost due to medication errors. The 2022 World Patient Safety Day, with its theme, Medication Safety, Medication Without Harm, is a global event celebrated every 17th of September. It is aimed at creating awareness about the unsafe practice of drug administration. However, this year's celebration brought to light the need to educate the populace as staff of the World Health Organization, the Federal Ministry of Health, stakeholders and other development partners took to the streets of Abuja, canvassing for a change in the way healthcare workers attend to citizens, particularly on drug consumption. Speaking at the event, Dr. Ehanire, represented by the Director of Hospital Service, Dr. Adebiyi, urged patients to imbibe in the culture of routine checkups, even as they are advised to report any malpractices in drug administration.
We are sensitizing the entire populace that it is not enough for you to have headache and you go grab paracetamol or Panadol from the pharmacy. Yes, it's out of the counter medication, but you still need to have the knowledge of the underlying condition. What is giving you that headache? Some people, it may be what they don't ever think of. So it's good for you to be examined by a healthcare professional and diagnosis made so that the correct medication can be given to you.
Also, a medical consultant, Federal Ministry of Health, Professor Stephen Abba, calls for more enlightenment on the dangers of drug abuse, stressing that there is a need to provide policies that will guide the administration of drugs for international best practice.
A policy to drive the action of regulators, government, individuals, stakeholders who will participate collectively to ensure that for every medication that you take anywhere in this country, there are rules and regulations guiding who gives it, how you take it, and consequences for when you take it from medication. Everybody takes medication at one time or the other in his or her life. And in a country like ours, where people can buy over-the-counter drugs, even drugs that are prescription drugs, people go to pharmacy and care for themselves. We need to educate them on the dangers inherent in this kind of practice. We need to know the drugs we are consuming.
On his part, the Chief Executive Officer of the Patient Safety Foundation, A.E. Eden, noted that every citizen has the right to know what drug is being administered to him or her, noting that when citizens are informed, it will help in addressing issues of error in drug medication.
Treatment is about patients. Patients should be at the center of the conversation. What drug are you being given? It is all right to know what the name of the drug you're taking. Why must you know the name? If there are contraindications, you should be able to say, this was what I took. You understand? So because this concerns you, it's important that you be at the center of this conversation. So empowerment of patient and patient reality is very important. We're not looking at patients alone. Patient reality is at the center of this. Why? Because patients, when they are sick, they might not even be in a position to administer the drug by themselves. Patient family have to administer this drug. So there's need to engage everyone and empower them on what to do. When you are not sure of the drug you are being given to, you have the right to refuse and say I'm not going to use it.
These experts say a lot of strategies have been put by the government to enhance the prosecution of offenders of medication errors, hence charging all to speak out to the relevant authorities to eradicate unprofessional conduct in the country. Vincent Okushi, QTV News, Abuja.